my first question would be to know more about your journey. Could you take us back to the beginning of your journey? What was the specific catalyst or clinical case that first led you to apply homeopathic principles to neurodevelopmental disorders like autism, ADHD? And over the years, how has your approach changed and evolved?
When I started my practice long back in 1990, like, so it was a private practice, and I was not knowing anything about these cases. Like, these cases used to come to me, like hyperactive children, people with delayed development, delayed talk, and all. And I used to treat them like, normally we take the symptoms and we prescribe. Like, so, but slowly, I found that I'm not getting results in that. I'll give you one example. Like, one child had come with very hyperactive child with delayed speech. So I took high restlessness in children, delayed speech like talk, slow learning too, and all. And based on that, and he was a very lean, thin child and all. And I prescribed calcarea iode. That was my first child, and I prescribed calcarea iode, right? Because he was lean, thin, and restlessness in children, and he had some fears and all. But then it was not working, because this I understood later on when I started treating ADHD children. Because in that child, the restlessness was not the characteristic of the child, it was the characteristic of the disorder itself, the ADHD, which I was not knowing at that time. Because maybe in our curriculum, these all disorders are not taught in detail, at least at our time,
True.
that time. So slowly, I felt that there is a need, that why I am not getting results in these kind of cases. So I just moved out of my private clinic, and I had the opportunity, great opportunity, to work with Dr. Praful Barwalia and Spandan Holistic Institute at Ghatkopar. And there the real journey started. Like, there we were seeing so many cases of hyperactive children, ADHD and autism, dyslexia, that we were now our training started how to approach these cases clinically also, as well as homeopathically also. So the so many patients there, slowly we learned. See, at that time I was, frankly speaking, I was not knowing what where to read. I was not knowing about DSM, nothing. So there the journey started, that what books we have to read for these kind of disorders. Because these are, see, nowadays Google is there, everything is there, you can Google it out, but the real thing, where it is given. So we started reading DSM-4, DSM, Kaplan Psychiatry, all, and there we got the knowledge that these are the disorders which we will cannot tackle like we tackle any other case in homeopathy. We will, unless we know about these disorders, we will not be able to, differentiate between the common symptom as well the characteristic symptoms. So what I used to feel as the characteristic symptom of the child, actually they were the common symptoms of the child, and that's why I was not getting the results. So the whole, scenario changed after when I started reading, when we started seeing these children, and then we got the opportunity to work in the research, autism research also, and it was all structuralized, like how to approach. You cannot just say, when a hyperactive child comes, oh, he's ADHD. No, it can be just hyperactivity. You have to really, because it is a child, you are labeling the child. It will have repercussion on his future, on his parents. So you really have to be very specific while telling the parents that your child has ADHD or it is just hyperactive. So first you have to be sure about it. And for that you have to be sure about it, you have to have the detailed knowledge about it and how to diagnose specifically, so that you are not haywire in telling that the child has these disorders. So actually from Spandan, it all changed. And then we came across the scope of homeopathy also in this, there, what we can do in these kind of disorders. So the journey started from there.